Medical experts are urging people to check their cholesterol levels sooner rather than later. Today, the American College of Cardiology, the American Heart Association, and a number of other medical groups issued new cholesterol treatment guidelines. They say younger people, even starting in their 30s, should start treating high cholesterol. The guidelines say doing so could cut down on risks of heart attack or stroke. So joining me now to talk about this new guidance is Dr. Natasha Bhuyan, National Medical Director of One Medical. This is so interesting.
Yeah.
I mean, I think what kind of raised the flags for me was as young as 30?
Yes, well, it's nuanced because a major focus of the new guidelines is making sure that we're detecting heart disease earlier and working to prevent it through lifestyle interventions like healthy eating or exercise. And now if that doesn't work, then consider starting a statin medication sooner, even as young as 30s. Now, that does not mean that people in their 30s all need to be on statin medications.
Right.
It's much more nuanced. It's really looking at someone's whole risk factors.
Okay.
What's their BMI? What's their blood pressure? Also looking at things like, do they have kidney disease or diabetes, and then based on that determining, does it make sense for them to be on a statin? Now, the other big change is the risk calculator now, it looks at someone's 30-year risk of having a heart attack or stroke. Before, it only looked at someone's 10-year risk, and what we're learning is that obviously heart disease develops over decades, and it's important to intervene as soon as possible.
Well, and doesn't it claim the lives of 1 out of 3 Americans?
It's the #1 killer globally.
Exactly. And, you know, it's interesting because a lot of people, they think, oh, well, this is an old person's problem, right?
Yeah.
That I shouldn't worry about high cholesterol. But I'm wondering if someone's taking it as young as maybe 30s, getting treatment for it, I mean, are there long-term effects down the line?
Well, ultimately, statins are safe and effective medications, especially for people who need them. But like any medications, they might have some side effects. So they might have digestive issues or muscle issues. So you shouldn't take it unnecessarily, but it's overall safe for people to take.
Is there additional testing?
Yeah, there are some additional testings that the guidelines recommend. So most people will get a lipid panel. That's what we've always done. But now they are also recommending, in some people, getting a coronary artery calcium scan. That's a non-contrast CT scan. It looks at plaque buildup around the heart arteries. And that might be for men over the age of 40 or women over the age of 45. If you're kind of borderline risk factors, you're not really sure, it's a great way to visualize the actual heart. And then the other test they're also recommending, lipoprotein A. That's a type of cholesterol that's mostly driven by family history and genetics, but it's good for adults to get one time to understand their family history. And then apolipo-B is another protein that we're kind of looking at certain populations. And so now we have a lot more tools to have a more holistic picture of someone.
Okay, this is a lot of information, but bottom line takeaway, what should people do?
Yeah, I would say that because it's based on your own risk factors, talk to your own primary care provider. What makes sense for you? I mean, ultimately, we treat people and not numbers, and so we want to treat the whole person. But the goal is we want to make sure that we are preventing people from having heart disease, heart attacks, and strokes in the long run. That's the goal.
Right, like everything really, you know, start early.
Start early, that's what it comes down to.
All right, Dr. Natasha, so great to see you.
Thanks so much.
I've missed you.
Yeah, thank you.
Thank you.